guys, in today's video, I'm gonna give you my tips as a dermatologist for how to take care of your skin while wearing a face mask. This is something that you all have reached out to me both on Instagram and here in the YouTube comments asking if I would cover. And before I get into my tips, I just wanna say that rashes related to wearing personal protective equipment are really common, and now more so than ever, obviously. My hope in this video is to share with you some tips and tricks for skincare that will minimize irritation to your skin and just make your life hopefully a little bit easier during this time period. Before I get into my tips and tricks though, I want to highlight a few things that are going on in relation to wearing the face mask. A moist, warm environment under occlusion, and that sets your skin barrier up for failure. It starts to eat away at your skin barrier. It makes you at risk for irritation. Outside of it just being warm and moist and under occlusion, the other thing you have to think about here is sweat. Sweat is no longer going to be able to evaporate off the surface of your skin as easily. It's going to sit on the surface of your skin, and sweat is an irritant to the skin and is going to further break down your skin barrier. The other component at play is maceration. By maceration, I mean points of contact of the mask on your skin that are rubbing and abrading the skin and further breaking down that skin barrier just by mechanical friction. Moving forward in approaching how you care for your skin during this time, keep in mind that your skin is a barrier to the outside world, and with the personal protective equipment that you are wearing, it is impairing your skin barrier underneath. So you have to modify some of the things that you typically do to make sure that you're not further jeopardizing your skin barrier. My number one tip is to abandon makeup at this time. No blush, no concealer, no foundation, no makeup whatsoever. This achieves a few things. First of all, it minimizes the number of things that come in contact with the skin and can further break down your skin barrier. Under this moist, occluded, humid, macerated environment, adding makeup to that milieu and makeup ingredients, it further can not only break down the skin barrier and lead to more problems, but it also puts you at risk for developing sensitivity to the different ingredients in makeup and subsequently developing an allergy to those ingredients that can cause a lot of problems for you. The second tip, anytime you cleanse your skin, whether it be just with water or with water and a cleanser, that removes some of your natural lipid barrier protection. It's really important that you be strategic with your cleansing and scale it down. If you're somebody who has been married to the idea of washing your face twice a day, seriously consider dialing it back to just once a day in the evening. And for cleansing the skin, I recommend using a non-soap gentle cleanser for washing your face. That will minimize disruption to the skin barrier. I'm gonna list down below in the description box some recommendations for gentle cleansers, but keep it to just once a day. Avoid wipes, micellar waters, makeup removers. All of these things ordinarily in your regular life you may have been fine with, but right now your skin is very vulnerable to irritation. So just stick to a very simple non-soap cleanser, and with no makeup, your skin cleansing needs are going to go down even further. The third thing that's really important is going to help you guys out is to use a barrier cream. Think about it. Your skin barrier is suffering. It needs some help from a friend in the form of a barrier cream. What do I mean by barrier cream? A barrier cream is something that is very occlusive and can really help in strengthening your skin barrier. These types of things typically are marketed as balms or ointments, and I've got several videos talking about them, but I'll show you an example. I have, this is actually available in the European market, but I'll show you some other ones. This is Eucerin's Atopy Control. I don't know if you can see that. Eucerin's Atopy Control cream. Can you appreciate how thick this is? This is what you want. Yeah, can you appreciate how thick that is? It almost looks like diaper rash cream. And that is in effect what diaper rash cream achieves, creating a barrier on, in the case of diaper rash, on the baby's butt. but you need something of a similar consistency for the skin on your face to protect that skin barrier. You may be wondering, should I use diaper rash cream then? You certainly can. That's usually a good consistency. The problem with diaper rash creams is that a lot of them have added fragrance in them, which is not a good idea at this point. Fragrance is an irritant, so you don't want irritation on top of that. But I have some barrier creams that I recommend for diaper rash that can be used on the face that I'll list down below. But yeah, this is a good one. And then another one that I recommend to you guys is the La Roche-Posay Cicaplast Balm B5. This has medecoside in it, which has been shown to be helpful for healing the skin barrier. The reason using a barrier cream is so important right now is that all day while you're wearing this mask, your skin barrier is being challenged, it's being compromised by humidity, by moisture, by maceration, by sweat, and you really need reinforcement. So putting on a barrier cream in the evening before you go to bed, for example, after your work day is done and you're just by yourself, that is really gonna be your best bet. During the day though, you also should wear one on your face before you put the mask on. Another option during the day in particular is to use a zinc oxide sunscreen marketed for babies. Zinc oxide can actually be very soothing to the skin, and you have sun protection in the areas of your face that are exposed, and it's inexpensive. I recommend choosing one that is marketed for babies because these tend to have minimal ingredients. So a mineral sunscreen I frequently recommend to people is Walgreens Baby SPF 50. You know, you could wear this during the day. It will really help your skin barrier and, you know, offer you some protection against ultraviolet light that does come through the window and can damage your skin and also exacerbate irritation. I also love the Elta MD UV Pure. This is a mineral sunscreen. These are going to have a white cast to them, but you know, I think that is something that you may not be as bothered by while you're wearing a mask. But yeah, I would keep it very simple with your skincare, as I always advocate, but now is really important. Very minimal skincare product use. Just a gentle non-soap cleanser, minimizing the number of times you wash your face, and a barrier cream, and ideally during the day, a zinc oxide mineral sunscreen acting as a barrier cream. Those things can definitely help. So check the description box. I will list some of these down below for you guys. But as far as lifestyle things that you also should be aware of, I would say another major contributing factor that you may not even realize is if you chew gum, it can aggravate rashes around your mouth. And the reason for that is a few-fold. First of all, when you chew gum, spittle, little flecks of saliva are gonna end up depositing around your mouth under that mask. Saliva, like sweat, is actually even more irritating to the skin barrier, so that's gonna further fuel the fire. So gum chewing actually can result in saliva not only on your lips but also around your mouth, and that can cause a lot of rashes because saliva, like sweat, is a skin irritant. There compounds in saliva that help break down our food, but they're very, very irritating on the surface of the skin. The other reason to avoid gum chewing though is that gum has flavorants added to it. Mint, peppermint, all sorts of ingredients that actually on the skin and on the lips can be very aggravating. In the setting of wearing a mask all day, your skin and the skin on your lips can't tolerate that. Puts you at more of a risk for cheilitis, which is rashes on the lips, as well as around the face, around the mouth. Along the lines of the gum chewing is your toothpaste. Highly fluoridated toothpaste and toothpaste that are flavored are associated with perioral dermatitis, which is what a lot of you guys are going through right now with the personal protective equipment. And so it's recommended in perioral dermatitis to go through a stint of using a low or no fluoride toothpaste, even though fluoride is very important for dental health, at least in the setting of an exacerbation of perioral dermatitis, which many of you are going through. Going to a low fluoride, no fluoride toothpaste for a period of time can help. The reason is probably not so much to do with the fluoride, but the sodium lauryl and laureth sulfates that are used in the formulation of the toothpaste can be very irritating to the skin and exacerbate this problem, we think. So that's a recommendation as far as the fluoride, but also a toothpaste that is not mint or cinnamon. The mint flavored toothpaste and the cinnamon flavored toothpaste, wintergreen, winter mint, those flavorants can exacerbate perioral dermatitis and cause some irritations around the mouth that are going to be exacerbated even further now in the situation of personal protective equipment with the mask. So switching up your toothpaste, it's probably not going to make a huge difference, but it certainly can remove one of the potential sources of aggravating factors in this bag of tricks that is going on under the mask. And so actually the best kind of toothpaste in this situation, I'll list them down below. I have a video on toothpaste, by the way, but the best kind of toothpaste are children's toothpaste that are berry flavored. Those seem to be okay. And I typically recommend Tom's of Maine Silly Strawberry, and a few others I'll put down below in the description box for you guys, but that certainly can help. And kind of related to the no makeup thing, but it goes along with the issue with gum, is no lip balms or lipsticks, chapsticks that have flavorants in them. I have a video on my top lip balms, and they would all be suitable for wearing on your lips to protect the skin of your lips under the mask. I'll list them down below. But lip balms and lipsticks, they often have the same flavorants that they add to chewing gum are in lip balms, and that your skin's just not. It is not in the mood for that right now, so I would avoid all of that. The other factor that can aggravate your skin is steam. I kind of alluded to this already with the fact that water on the skin, moisture on the skin is irritating to it, but steam can as well. So I recommend trying to limit the consumption of hot, steamy soups and beverages. Soups in particular, it's not something that you would think about, but it actually can end up aggravating your skin a lot. Here's why. Because you've got the steam coming up to your face, and that steam is carrying with it some degree of some of the spices in the soup that can then condense on your skin. So you have the steam that in and of itself is aggravating the skin, plus you have spices condensing onto the surface of the skin. It can definitely exacerbate these skin problems that you're going to be experiencing with wearing the mask, which include rashes around the mouth and acne-like breakouts. Be really careful when you cook as well. If you boil, you're making pasta, all of that steam, it can aggravate these problems for you much, much more. So try and avoid hot liquids, cooking with hot, steamy things. And along those lines, definitely this is not a time to be using any sort of facial steaming device or steaming the face. Be really careful. Steam results in drawing water out of the skin, further drying out the skin barrier, and it can just cause a lot of problems. I have a video going into detail on why you should not use a facial steamer, but this is definitely not the time to be steaming your face. So those are some things that can help. The other thing I would suggest strongly that you not do is self-treat any rashes on the face with over-the-counter or self-prescribed topical steroids. This can be really tempting, and I caution you against doing it for these reasons. Topical steroids around the mouth area in particular, they can make the rash go away very quickly, but when they're stopped, they can result in a rebounding worsening of rashes around the mouth. This is referred to as perioral dermatitis, and a lot of you already suffer from this. And using high potency topical steroids or any topical steroid, that's a risk. That's a risk that we counsel patients on. So it's kind of a slippery slope, and I caution you against self-treating with topical steroids. I even saw a blog post when I was preparing to do this that somebody was like, yeah, use cortisone, cortizone cream that you can buy over the counter. I caution you against doing that because you might find that it improves your skin problem right away, but when you stop it, you can get a rebound worsening. That being said, some of the rashes that may develop related to wearing a mask would be well suited to be treated with a topical steroid. So I'm not saying that topical steroids are necessarily a hard and fast no, but I caution you against self-treating with them because problems can arise, especially if you're treating the wrong type of rash with a topical steroid. So I would say try and resist the urge to self-treat with a topical steroid. And even though a lot of dermatology practices have closed and are only seeing emergency cases, definitely call your derm, because most of us are doing some element of telemedicine, and this is something that they could easily potentially evaluate through their telemedicine platforms. But make sure it's with your doctor or a doctor within your plan. Don't just send a photograph to somebody randomly who's a doctor. Like, if you're in healthcare, you know it has to be through a privacy secure platform. Right now in healthcare, telemedicine is booming, obviously. And so a lot of dermatology practices have quickly adapted to it and have it in their practice. So you may have seen a dermatologist a few years ago who knows you, and their office is closed, but see if they're not doing some element of telemedicine and could evaluate your rash rather than self-treating it with a topical steroid. The last thing I'll comment on is bruising related to masks and personal protective equipment on the face. There's not a lot that you can do in this time to prevent that. Things that we do in dermatology to treat bruising include pulse dye laser can help treat bruising, but obviously you're not going to be able to pursue that right now. Nobody's doing pulse dye laser for bruising, given everything that's going on. Most of that is on the back burner right now. But one thing that is also done for bruising, although I've got to be honest with you guys, it's not the most evidence-based thing, but it is something that we do in dermatology, and that is to use topical vitamin K oxide. This is frequently something that we give to patients after a laser procedure to minimize post-laser bruising, or what's called post-procedural purpura. Sorry, a gnat just flew by. Post-procedural purpura related to a laser, we'll use a topical vitamin K oxide, or even with filler injections. Sometimes there can be bruising related to filler injections, and using topical vitamin K after those procedures has been shown to minimize bruising and improve patient satisfaction. So that's something that we do for these cosmetic indications, but so in effect, it can help minimize bruising. It has to be vitamin K oxide though. A lot of vitamin K creams that you'll see over the counter, or that you can buy online, they're just vitamin K. And it makes a difference because vitamin K, like a lot of other topical vitamins, is not super stable. It degrades very easily, and it actually can be irritating and cause contact dermatitis. So rather than chasing a vitamin K cream, like, you're better off not doing that. But if you're motivated to use vitamin K to minimize the appearance of bruising, I suggest you go with the vitamin K oxide, because it is stabilized and has a much lower risk of contact dermatitis. Your skin right now, with the mask wearing and everything, the personal protective equipment, remember I said the skin barrier is impaired, so you're more at risk for developing an irritation of something. So definitely go with the stabilized vitamin K oxide if you're motivated to pursue this. But anyway, the company BioPill actually makes an eye cream that has vitamin K oxide in it. You can get it on Derm Store. Not cheap, but if you're motivated to use topical vitamin K for minimizing bruising, I suggest going with the vitamin K oxide. And obviously the BioPill one is safe enough is formulated to be used around the eyes. So if you have some bruising on the infraorbital bone, and you want to use it around your eyes, this certainly is an option, but pretty expensive. I mean, it's up to you is what I'm saying. It wouldn't be my strongest recommendation, but it is something that's available and can potentially help. Another ingredient that also has some limited evidence, mostly anecdotal, but we recommend it sometimes, is topical arnica. Arnica, you'll find arnica in a lot of bruising, creams that are marketed to improve the appearance of a bruise, and it does. We don't know how it works. A risk with arnica, however, is contact dermatitis. So I'm not the biggest fan of using arnica, especially in this situation. Vitamin K oxide is a better choice, but is obviously more expensive. But I thought I would mention the arnica because you'll hear arnica gel mentioned a lot. So those are my skincare tips as a dermatologist, and it is my hope that these tips will help you guys in any way. Thank you so much to all of the first responders and people who are in the hospital right now taking care of these very sick patients. I really hope that these tips that I've given you in this video can provide you with some relief from all of the skin problems that you're coping with while wearing all of this personal protective equipment during this time. So if this video is helpful to you and you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.